Hello to everybody and welcome to my channel Dr. Scalpel Artist. Today I'm here to teach you guys about the suturing, but before starting the suture let me give you a small introduction how to unpack the what is called the thread which suture we are having within the packet, right? So here I think you can see you are having a angular like is there or arrow like, can you see this one? So this is the area through which we will be unpacking it, and similarly here you will be having open part will be there. So normally what is going to happen is that obviously now I'm not wearing the gloves and all, but in the practical life you will have to wear the gloves and then proceed. And before wearing the gloves obviously you will have to go for what is hand washing and all, then you'll be having the sterile gloves, so and so. So how to wear the gloves, how to unpack the gloves, etc., this all I'll be teaching you in the another video. Today I'm just teaching you about how to open the what is called the packet of the thread. So you'll be just holding in this way and you'll be pulling it off, pulling it apart. So here what is you can see here, this is the sterile portion, this is completely sterile. So you'll be just dropping in the sterile field. So what is the sterile field? This is the area where you are going to work, means where you are going to do the surgical procedure, etc. So that is the sterile field. Understood? In fact we can't sterile the skin, but we can just disinfect that, right? So further we'll be doing painting, etc. and all. So let us proceed further. So after this what we are going to do, we'll be just again here you're having the little bit cut is there, so from that we'll be pulling apart, then finally we'll get the thread whatever we are having, right? This is our needle holder. We'll with the help of this we'll be pulling it out. So about the instruments, the needle holder, scissor, tissue holding forceps, these things I'll be again explaining you in the class and the lectures. So let me start with this. So now here we are having the thread, right? So whether this thread is what is called prolene or what is whether it is proper what is called vacryl, whether it is silk, etc., again about this classification I'll be explaining in the other videos. So let us begin with this one, right? So we'll be just holding it, and there are very methods are there for how to hold the needle and what will be the what are the rules, etc. So for that you should understand, will be with respect to the needle will be holding 1/3 from the swage. Now what is swage again? Swage is the area where the thread has been embedded within the needle, right? The metallic portion of the needle. So this is the swage in this area we are having. So similarly we'll be having certain needles where we are having the eye. So about the needle again I'll be explaining in the another lecture. So from the tip we are having 2/3 from the swage, what is called 1/3 in this portion, and this portion I'm talking about. So we'll be holding there, and with respect to the needle holder we'll be holding at the tip of the needle holder. So this is how we are going to hold it. Clear? Okay. So as I have already held the needle, now again there is a rule for holding the what is called needle holder, as well as there is a rule for holding the forceps. So what are those rules? Again I'll be explaining those things in the separate other videos and all. So today I'm going to teach you simple interpret suture. So for doing simple interpret suture you should have little knowledge about the anatomy of the wound I'm talking about. So right now in this video I'm not going to explain about that because it will be lengthy. So just 1 or 2 points I'll be explaining you. What is that? Just listen carefully. Can you see this part? This is the edge of the wound, and whatever you are seeing on this is the surface of the wound. Am I correct? So when you are going to pierce the needle, now what is the piercing the needle called in what is called medical point of view? That is called as taking the bite. So from this edge we will be taking x distance. Now what is x distance again? So this I'll be explaining again in the anatomy when I'll be explaining the anatomy of the wound, right? So exactly I'll be taking the bite at x distance. Look, I'm holding here, I'm taking the bite, and that time I was taking the bite. Now when I'm pushing this needle, this is called as driving the needle. Now remember point, look at here, I'm holding very close to the end of the needle. So this is the one of the weakest point of the needle. So where is the other weakest point? And the weakest point is this tip part. Can you see this one? So we are having two weakest point in the needle, that is the tip, or another word it is called as point. Other one here you are having eye or the swage. So after this I am going to hold it and again pull the needle out. So this portion is called as driving out. Before this I was doing the driving in, now I am doing the driving out. So when you are pulling this thread, be careful. Please do not use the metallic instruments because of this there will be tear and wear. So what is the better way? Use your finger and then pull in this way. So here finally I'll be pulling till the end. Now I hope you guys are understanding me very well. Now after this, so what was the depth I went? The distance from the edge was x, and the depth was also x distance. Now what is x distance? X distance is the depth of the wound we can talk about. Now next bite, where will we take? Exactly in front of that we'll be taking it, and again we'll be taking at the x distance deeper, and we'll be driving out x distance away from the wound edge. Got my point? Now look here, now again I'm driving it out here. This much clear? After doing this, now what I'm going to do, I'm not going to lock the needle holder, just I'm going to hold it, and I'm going to rotate the suturing thread around it one time. This is the one time, and this is the second time. So total 2 rounds will be making it, and with the tip of the needle holder and the tip of the thread we are going to hold it, and then we are going to pull in the opposite side. So now I hope you can see here like a DNA helix right here, right? So this is called as the reef. So once the reef knot is formed, we'll be pulling it little tighter. So how tight will it pull? The point is that you should be pulling in such a way that the one wound edge comes approximate to another wound edge, right? And after that, when you now you will be moving one. This is the smaller limb in my right hand where I'm having the needle holder, and the other one is the longer limb. So I'll pull the smaller limb towards the longer limb. So why am I doing so? I'm doing it because if I'll not do this, what is going to happen? Tissues are having the retractile capacity. So because of that, they will again retract back and it may reopen. So to prevent that, I'm pulling on the one side, and this is called as the locking, right? Now again, that time I went clockwise. Now I'm going anti-clockwise once. I'll do anti-clockwise only one time. Again, tip to tip. So holding the tip of the thread with the help of tip of the needle is called as tip to tip rule. So now I'm just pulling it. So finally I have finished it. So let me finish the kit completely. So before finishing, what I'm going to do is that I will hold the thread and I will cut it. I hope you can understand. So when I'm cutting it, what should be the distance of the thread to be left? This should be less than 2x. Why 2x? Because next suture I'm going to do, I'll be doing, or you should do after 2x distance. Understood? I hope you understood till now. So this was about doing the suturing. And what is the name of the suture? This is the simple interrupted suture. Why simple interrupted? Because I have cut the thread, I have cut the suture, and after this again I'll do another suture. Again that also I'll be cutting it. So we are making the interruption between the two sutures. So that is what is called a simple interrupted. Now let me cut and remove it. So for removal, again there are techniques are there, and certain things are there which you should understand. Now the things which you should understand is that this is exposed outside, right? So even if we clean with the betadine solutions, etc. and all, after this, chances is that here you may have the infections. Why? Because this right now I'm having the monofilament, but maybe you are using the multifilament. Maybe you are using what is called the braided sutures, etc. So again, in between the crevices of the braids, you may have the pockets for growing of the what is called infection. Why? Whenever you are driving, chances for accumulation of the blood can be there, which is very good for the dwelling of the what is called microbes. So to prevent that, whenever we are removing, be careful, none of this portion should enter the tissue, because if it enters, it will be transporting along with what? It will be transporting the microbes along with it, right? So that should be prevented. So further, what we are going to do, we will hold the knot. Can you see the knot? I hope you are able to see the knot, sir. Look here, can you see? I'll be holding it tightly, and I'll pull a little bit so that it is getting it is getting away from the skin, and I'll be just cutting just below that. Understood? I'll be holding it tightly, but be careful. After cutting it, do not pull it. Understood? Just hold it. Now look here. Now what happened? Now where should I move? If I'm moving in this part, just look at the tip of the scissor. If I'm moving on this side, what chances is that what is called the wound can reopen. So the best technique is to move towards the wound line. So this is the wound. This was two edges were there. After doing the suturing, it can be called as wound line. So I'll be moving towards that, and then I'll be removing the suture. This is the technique of doing the simple interrupted as well as removing the simple interrupted suture. And remaining portions I'll be teaching you in the next lecture. Thank you so much.